Well, two of Wisconsin's children's hospitals are joining in 2025 in an attempt to serve more children with congenital heart disease, the most common form of birth defect.
Earlier today, I sat down with the president of American Family Children's Hospital. Nikki Stafford explains how this partnership will serve pediatric patients all over Wisconsin.
We recently announced that we are going to combine our services together in order to provide congenital heart care. We will do this under a joint venture where both organizations will operate, creating a single collaborative program that will provide comprehensive care across two organizations that really will allow kids and families to keep care close to home throughout a larger geographic area.
You mentioned keeping care close to home. How else is this going to be able to kind of enhance how you guys care for patients?
Well, we know that there's a really strong correlation between volumes and clinical outcomes. And so when you have two mid-sized programs that come together, what you're able to do is to be able to not only have a broader reach in a geographic area, but also to have those sustained volumes that lead to high clinical outcomes. And high clinical outcomes, we know, not only attract, but they also retain top talent.
And this partnership is kind of centered around pediatric cardiac care. Tell us about heart disease in kids. What does that look like? Is it common? And what kind of care do they need?
We know that kids who have an abnormality, to their heart before they are born, those kids are not only surviving, but are thriving as adults. And so it's really important that we create that continuum of care from the time that they, from the fetus all the way through their adulthood.
For existing patients, how will this affect their providers, their care?
So kids and families should not see any changes to their clinical care. They will continue to receive their care at their medical home. So whether that's Children's Wisconsin or UW Health Kids.
And then why Milwaukee? Why this partnership between UW Health Kids and Children's over in Milwaukee?
Well, I think it was really important for us to really think about how we collaborate with another organization. And we wanted to collaborate with another organization that had a really strong reputation that was very similar to ours. And I think Children's Wisconsin has had a long and rich history, very similar to us, in caring for kids, not just here in Wisconsin, but throughout the Midwest. So for us, they seem like the best person to collaborate with.
Awesome. Nikki Stafford, thank you so much for joining us. We appreciate your work.
Thank you.